We're live.
Hello and welcome. I'm Randy Reiser. I'm president of the Medical Association of Atlanta. And on behalf of the nearly 2,000 doctors that comprise our organization, I want to thank you for joining us for tonight's town hall meeting. Over the course of the next hour, we would like to give you information that you can use to make healthcare decisions that will be the best for yourself and for your loved ones. You know, over the past year, we have all been bombarded with information regarding the pandemic and about what we should do and what we shouldn't do. And this information is oftentimes contradictory and it's always changing. And one of the questions that comes up is what information can I trust and what don't I trust? This topic was addressed in a national survey that's been conducted over the past year and updated frequently. And on our next slide, we see the results of the question, who do you trust least for your healthcare information? Uh, Not surprisingly, most people responded that the least trustworthy form of information was social media. But right after that was the federal government and also broadcast news media, newspapers and magazines. Even the WHO was felt not to be a particularly trustworthy source of information. On the other hand, when people were asked, who do you trust the most? We see on the next slide that people tend to trust healthcare organizations. The local health departments and the health systems are trusted more than the WHO. The CDC is listed as the most trusted source of information by about 50% of Americans. But perennially throughout the survey, the one source of information that people trusted the most was information they received from their doctor. And so tonight for you, we have two very trusted doctors. Next slide. Dr. Carlos Del Rio and Dr. Jayne Morgan. Our special guest tonight, Dr. Del Rio, is an infectious disease specialist and is a epidemiologist as well. He has spent his whole career treating viral illnesses and also working on vaccines to cure them. He's a distinguished professor of medicine at Emory University Medical School and is also a professor of epidemiology at the Rollins School of Public Health. Welcome, Dr. Del Rio. And Dr. Del Rio has been the lead investigator, or one of the lead investigators in the clinical trials that have led to the approval of the Moderna vaccine. He's been on multiple uh, appearances on national television as well. And moderating our conversation with Dr. Del Rio tonight is Dr. Jayne Morgan. She is uh, a very valued member of the board of directors of our Medical Association of Atlanta. She is a practicing cardiologist and is also the clinical director of the COVID task force at Piedmont Healthcare Corporation here in Atlanta. Dr. Del Rio and Dr. Morgan are going to engage in a conversation discussing their involvement over the past year with the fight against the COVID pandemic and share their experiences and the lessons that they've learned from the battle. This conversation, however, is going to be guided in a large degree by your questions. And so we encourage you to submit your questions using the Q&A app function here on your screen. The questions will be seen just by the panelists and their sources will be kept confidential. Please feel free to submit your questions at any time. As a matter of fact, the earlier you submit them, the better, because our time is limited and that'll give you the best chance of having your questions directly addressed. So Dr. Del Rio, Dr. Morgan, thank you again for being with us. And Dr. Morgan, it's my pleasure to turn the program over to you to begin the conversation.
Thank you, and I welcome everyone. And we'll just jump right into it. We are obviously very honored to have Dr. Carlos Del Rio with us this evening, and we want to make certain that we make the most use of his time and that we receive the most information from him. And so when I talk with you, Carlos, certainly as we look at the Piedmont system, which is where I am, we have some, common questions that tend to come up. People want to know, what is messenger RNA and why was it being used, or they're concerned about chronic medical conditions or their comorbidities. Those are some of the questions that come up, including, if I receive both doses, can I now visit elderly relatives, or can I visit children if I'm a grandparent? And these are the kinds of questions that I commonly encounter. And I thought we could start with maybe just discussing some of those. And what is your perspective? Maybe we can just start out with one of the common questions. Why did we use mRNA this time? And what is it?
Well, Jayne, first of all, it's a pleasure to be with you. Both here in Atlanta, Piedmont, Emory, Grady, we all, one thing that puts us together in this pandemic is we all really work together. And I think one of the good things, one of the silver linings of the pandemic is how I've seen our CMOs and CEOs kind of be talking to each other, learning from each other, because the reality is that in this pandemic, we're all learning, right? And that brings us to the vaccines. I think as we are rolling out vaccines, there's a lot of education to be done. There's a lot of learning to be done. And we all need to be informed. And there's a lot of information that is happening. One of this is what are these vaccines? Because the reality is they're very different vaccines from the vaccines we've used up to now. And they are vaccines based on new technologies like the mRNA technology and the adenovirus technology, now with the Johnson & Johnson vaccine. And what that means is simply this is the vehicle in which of how once we found out that the spike protein was critical in the creation of not only attachment to the cells, to invading the cells, but also was very important in creating antibodies that protect you from infection. And that was the immunogenic part of the virus. Then the idea is, how do you make antibodies against the spike protein? And you can do it through creation by just giving the spike protein by itself, a protein, which is what the Novavax vaccine is doing. But it's a lot easier to put that protein inside a vector. And you can put it inside a viral vector, or you can take that RNA and put it inside a messenger RNA and make the cells produce the spike protein. And that's what this new technology is doing. Now, it's new, but it's not that new. It's been researched for 20 years. It's been used in the Ebola vaccine. So it's a revolutionary technology. And what I tell people when they say, I never use this technology, I ask them, well, do you have a cell phone? And they say, yeah, I have a cell phone. I said, I bet you your parents had a rotary phone. And I bet you don't have a rotary phone. They say, yeah. I said, well, a rotary phone is the old vaccines. The messenger RNA is the iPhones that you're using nowadays. And if you'd like to use your iPhone instead of a rotary phone, you ought to be really happy that technology advances and now you have a cell phone. Now you have, a new technology. So technology changes, and I think technology and research over the years has actually given us this vaccines in less than a year. And to me, that's the incredible thing, right? All the research, all that money that the US invests in research has actually paid off, giving us a vaccine in less than a year. To me, it's one of the most amazing things we've seen in this pandemic.
Yeah, I can't agree more. And not only that, we were able to streamline the clinical development process for the vaccine companies. And instead of doing the phases in tandem, we were able to do phase 1, phase 2, phase 3 more in a stacked form, and simultaneously more resources were put towards that. And I think what we've learned is not only can we do that, we can speed up the development, but we can do it safely. And these vaccines are a great example of that.
And I think I want to be real clear about what you said, because it's absolutely right. We stacked up and we did things in much more, sort of efficient way, but we did not cut corners.
That's
At
right.
no time were corners are cut. At no time was safety compromised. And I can tell you, being an investigator in these studies, that as a vaccine researcher, even though the company is looking at efficacy, as a vaccine investigator, my biggest concern is safety. Because vaccine volunteers are healthy volunteers. You don't want it to be injured. And therefore, safety is my number one concern, and for all of the investigators. And I tell you, they were incredibly safe. And we were surprised how effective they were. We were hoping for a 60% efficacy. When it was 95%, we were all like, wow, this is really, this is really hitting out of the park. But the second thing is I will give credit to the Trump administration and to Operation Warp Speed, because they didn't do a lot of things that I agree with in this pandemic, but they did have one thing that I agree with in this pandemic, which is, first of all, make a very streamlined process. But second, I think something that many people don't know is the government's invested millions of dollars by telling these companies, once their vaccine made it to clinical trials, start producing the vaccines.
Mm-hmm.
And if we get to the end of the clinical trial, the vaccine works, we got vaccine available, which was the case. If we get to the clinical trial, at the end of the clinical trial, and the vaccine doesn't work, well, we'll throw the vaccine away.
Mm-hmm.
So the loss is going to be financial,
Right.
but it's not going to be, then in normal circumstances, we would have ended the clinical trials and then start production. That wasn't the case this time around. And it wasn't, and as a result of that, approval by the FDA, the EUA occurred on December 11th. By December 14th, we were vaccinating people, and we were vaccinating because we had vaccine available. It had already been started to be produced.
Mm-hmm. And I think, that's a great point when we look at what Randy presented right at the beginning. The interesting thing about that is that Operation Warp Speed was able to bring us vaccines more quickly, and we were able to streamline this process safely. But ironically, it served as a nidus to increase suspicion. When we looked at the chart that Randy presented, the U.S. government was towards the top of not being trusted in these vaccines. And so in many ways, it's sort of an irony of the development of these vaccines and how we move into these discussions of vaccine hesitancy and what are people concerned about. And so I think, certainly you make a great point with that.
I think that, we can talk about a lot of things that could have happened, but I think the communication wasn't done appropriately, and I think could have been done better. And that's unfortunate, because right now we're having to do the communication that wasn't done before. Mm-hmm. The other thing that I would say is, again, we as healthcare providers have to set the example. So, the vaccine started vaccinating in this country on December 14th. Emory started vaccinating the weekend of December 19th. I was one of the first persons getting vaccinated. Number one, because I see patients with COVID, but number two, because the opportunity was given to me by Emory, and I wanted to be sure that I took the vaccine so I can tell people what it was like to get a vaccine.
Mm-hmm. Yeah. When we're looking at now, 6.1% of the population here in the United States has received at least one vaccine. So, we are starting to move that needle ever so slowly as we continue the rollout of these vaccines. And so as we see increasingly more people vaccinated, we start to get more questions about now what that I'm vaccinated. And one of the things that I hear often is, hey, Dr. Morgan, I received both vaccines, but I went and had my antibodies drawn, and they said that it was zero. I'm not protected. What does that mean? Is the vaccine not working? And what do you think about that when people talk about those kinds of, I can tell you what my answer is, but certainly I would give you that question.
I would start by first saying I sure hope that pretty much all the members of the Medical Association of Atlanta are vaccinated, because we have a role to play by having the vaccine and by telling our patients and by talking to our patients about the importance of getting vaccinated. So we must be vaccinated. I'm hoping that everybody has, and if they have, you should have a button from the Medical Association of Atlanta saying, I have received my vaccine and you should wear it. But the second thing is, once you've been vaccinated, it is not recommended you check your antibodies, because first of all, the type of antibodies that need to be checked are not the common antibody test available. Most of the antibody tests available check for nucleoprotein, and you need an antibody test that checks for spike protein, which is not every test. And number two, the protection is not just done by antibodies, it's also done by T cells and other things. So just get the vaccine. Don't check your immunity. It's not necessary to do that.
Yeah, no, absolutely. And I love that answer. One of the other things that, not only are we grappling with this at Piedmont, but also really across the nation is this vaccine hesitancy, certainly by populations of color, but healthcare workers as well. And we are starting to try to get an understanding of that when we look at populations of color and the African-American population in particular. This vaccine sort of represents that triumvirate of things that generate suspicion in the community. So for instance, the healthcare system, where maybe there's not a great relationship with African-American community and the hospitals. And then we also bring in research, which because of historical atrocities, there's also not a great degree of confidence. And then we bring in the US government, where there's also somewhat of an uneasy relationship. And so this is sort of the triumvirate. When all three of these things come together for this vaccine, it certainly shouldn't be a surprise as to why there are a lot of questions and why there's vaccine hesitancy. What are you all doing at Emory? Is this something that you all are recognizing? And how are you all moving to address it or encourage the use of vaccinations of everyone?
Well, you just have to listen to people.
Mm-hmm.
You have to listen to their doubts, and then you have to answer their questions. This is a labor of love. This is going one by one. This is talking to people. This is hearing people. And, it's a lot of the what we call hesitancy. I want to distinguish the anti-vaxxers, which is a different movement, from people here that simply, a friend of mine, Dr. Kimberly Manning, calls them the slow yeses. They're just slow at getting to yes. They're going to get to yes. But what they need is to talk to us, to hear from us, to discuss it with us. And what I tell people is we also have time, right? Because there's an issue of supply demand. There's not enough vaccines right now. Right. So we need to use this time to talk to people about, hey, it's important to get vaccinated. Well, I have doubts. I want to wait. I'm worried about, something getting into my DNA, et cetera. We talk about all those issues, and we talk over and over, and we address them. And you need to make people, the key here is trust. Mm-hmm. And you got to get people to trust you. And once you get people to trust you, it makes a big difference. I was in my office the other day, and the person that does the cleaning at the building came over and said, "Can I talk to you?" And I said, "Yeah." And this person started asking me about the vaccine, and they said, I didn't think I was going to get it. I didn't want to get it, but after talking to you, I trust you and I want to take it. So, but it required me spending some time and saying, hey, I'm happy to listen to you. Tell me what your concerns are. And you have to do it in a non-judgmental way. You have to listen. You have to take their concerns seriously, and you have to address them. And if after your conversation, people say, I still have doubts, you need to say, fine, come back and let's continue talking, right? This is a process, and we're not going to turn everybody around in a dime. It's going to take some time. But what I found incredibly useful is basically to create an environment of communication and to open that dialogue.
Right. And I think you're right. Education is the key. That is such a great approach, and patience, and not moving forward with thinking, I'm going to meet with this person to convince them. And just as you said, you really meet with them to listen and see if you can address some of those concerns. And I think that is a great approach. And, one of the things that I've been thinking as well is maybe there's not a rush to convince everyone to get vaccinated right now, because we don't really even have the supply for everyone. So you have time to think about it. There's not supply for everything. So take your time and think about it. And be able to make a decision with information and a decision that's informed. So I agree with that as well.
And also not to have preconceived notions, because I would say that I'll give you a story. I called a friend. I called Tyler Perry, and I said, Tyler, I would like you to get your vaccine, and let's tape it, and so we can show it, and people will be more likely to get vaccinated because they saw you getting a vaccine. And, he got on the phone with me and said, I hear you, but why do you think I want to get the vaccine? I said, well, I didn't know. And he said, I have a lot of questions. Would you be willing to answer my questions? And I said, why don't we do something? Let's go to your studio, and I'll bring a friend of mine, Dr. Manning, and the both of us will answer your questions. And let's tape that. Let's tape that episode of you answering questions. And if at the end of that you want to get the vaccine, we'll vaccinate you. But if you still have doubts, we'll not going to press you. And it was really interesting because then he started asking a lot of really smart questions. And at the end of that, he said, I'm convinced that I need to get the vaccine. But again, even somebody who is informed, who is educated, who is knowledgeable, had a lot of questions. So we frequently say, oh, it's the people that, are lower socioeconomic, et cetera. No, everybody has a right to have questions, and we need to answer their questions.
Yeah, absolutely. I mean, we've seen a lot of hesitation even amongst healthcare workers. And I think, that goes a long way in demonstrating exactly what you've said. And additionally, I think you demonstrated well what we also saw on Randy's slides at the beginning, that the physician is the most trusted source. And Tyler Perry wanted to sit down with you at the top of the heap and get the information from a physician and not get it from his other friends or social media. And so we have to really have real reverence for our positions and our ability to provide knowledge and provide information to our patients and to society and take it seriously, because people are looking for scientific voices that they can trust and easy to understand language that they understand and it's not going over their head. So, I mean, absolutely, that was demonstrated well.
So you asked a question, what can I do after I've been vaccinated?
Yeah.
I tell you first of all, what CDC tells you can do. You no longer need to isolate, to quarantine after you've been exposed to somebody. If you've been fully vaccinated and it's been 2 weeks since you were fully vaccinated, you don't need to quarantine for the next 3 months after you've been exposed to somebody. That's huge. But the other thing, I tell people, there's certain things you can do and you need to start weighing them out. Last weekend, for example, I had dinner with a friend of ours and his wife. They're both vaccinated. Me and my wife are vaccinated. We had dinner at their house. We were socially distanced, but we were able to have dinner together outside in a well-ventilated area, but without wearing a mask. I mean, that felt so good, honestly. There's certain things you can start doing. This Friday, I'm going to get on a plane and go to Miami to visit my son who recently had a baby. Again, I'm going to wear my mask in the plane, but I just feel much more relaxed. I know that if I get infected, at least I won't get sick, but I feel more relaxed about it. In the past, I would have said, no, never, I won't do this. So I think now there's certain things I would not do even after vaccination. And that's, for example, I'm not going to attend an event that 250 people are there. And I'm going to go to a bar. And why? Because there's still a lot of community transmission out there. There's still a lot of virus in the community. Now, once the amount of virus in the community comes down, I may change what I do. But for the time being, the most important thing I tell people is I'm much more relaxed about going places. Quite frankly, in the past, I would get on the elevator at Grady Hospital. And if there were more than 2 other people in the elevator, 3 people in the elevator, I would get off the elevator. I would walk up 11 flights that was necessary. Nowadays, I'm more comfortable inside the elevator. I'm wearing my mask, I'm wearing my eye protection, but I don't have that sense of, oh my God, somebody could be infected here and I'm going to get infected. And that to me is a huge sigh of relief.
Mm-hmm. Yeah, one thing, with the UK and Israel coming out with these studies, which are observational studies, but it looks as if not only does the Pfizer vaccine reduce your transmission ability, it also reduces the viral load such that if you do become infected, you're less likely to infect someone else because your viral load is down. And so in that way, the messaging of vaccines don't just keep you safe, they also keep those around you safe. And I think just what you described, sort of these vaccination pods, you get together with all of your other friends who are vaccinated, and we sort of have these safety pods. You're still outdoors, but and you're socially distanced. And what does that mean? And I think people are starting to have those questions as we see more and more people vaccinated. For instance, grandparents who've been vaccinated, older people have been some of the first ones to be vaccinated, now want to visit their unvaccinated grandchildren. That's a very common question that we're starting to have. And is that something that you think people can start to do? They wear their mask, but they now go and visit their grandchildren. Everyone's been isolated for a year, or do we need to hang on just a bit longer?
Well, I think you do two things. Yes,
Mhm.
if you can hang out a bit longer, but on the other hand, if you have the opportunity and go visit your grandma and grandpa, and everybody is masked, and the grandparents have been immunized, I think it's okay. Again, at
Mhm.
some point in time, everybody, we take risk on a daily basis. I drive to work every day. I
Yeah.
cross the street. Nothing is risk free. But what we learn to do is to reduce risk, right? And again, here is, I'm not going to go visit them and everybody takes off their mask and they're fine. You still do those other things, but yes, you can do them. And I think if they're vaccinated, you feel so much better. I
Right.
mean, I told you I'm going to Miami to visit my son. I'm vaccinated, but today I went to get my PCR testing, right? I'm going to get on a flight and I want it to be tested before I go, just to be sure that I'm absolutely sure that I'm going to be, PCR negative before I get on the flight. And when we get to Miami, 2 days later, I'll get tested. 3 days later, I'm going to get tested. I'll be isolated. But I think we want to decrease risk as much as possible.
Right.
And that decreasing risk, I think all of us in healthcare understand what that means. It's a little bit like why we wash our hands before we see a patient. Why should we do several things that are maybe not very significant, but they do make a difference.
Right. What do you think about now that people are vaccinated, like yourself and myself, and people have a COVID positive person in the household or someone that they need to take care of? Could you feel free to take care of that person since you're vaccinated? Or, so these are sort of, we start to get these, levels of complicated questions while we're in this transition zone.
Well, again, I tell people I take care of COVID patients from the very beginning. I took care of them in the consult service, in the hospital. How do I do it? I wear my PPE. And
Right.
after I've been vaccinated, I still wear my PPE. I was in clinic today. So, if I'm going to go see a COVID patient in the ICU or in the floor, I'm going to put on my PPE whether I'm vaccinated or not. But I just feel that I'm a lot more relaxed than I was before, right?
Mhm.
Before I was totally so obsessive about how I took on my PPE, not getting contaminated. Now I'm a little more relaxed, but I'm still careful. So if I had somebody at home I need to take care of that COVID, I would wear gloves, I would wear my mask, I would wear my eye cover. But I think, you don't need to shunt them. You can certainly take care of them, but you just need to be careful. And again, if we've learned something in this past years, we learned that infection control works.
Right. Yeah, absolutely. Public health policies, still wearing your mask, still washing your hands, still practicing social distancing. All of that is so incredibly important. As we look at the Johnson & Johnson vaccine, which maybe will be the third one that comes available to us under an emergency use authorization, they had different endpoints from Moderna and Pfizer. They have different levels of success with their efficacy. And I guess if I'm being, specific, in the US, they have 72% efficacy, meaning how well, for their endpoint, it was moderate to severe disease, preventing moderate to severe disease, and then a little less when we look at Brazil, and then a little less when we look at South Africa, where some of these variants are coming out. And so people have had some questions with regard to, well, Moderna and Pfizer are closer to 95% efficacy. Now we have something that will be 72% efficacious in the US. And yet, we understand that Moderna and Pfizer, when they were running their clinical trials, these variants weren't around. And so it's opening a lot of conversation regarding the single dose with Johnson & Johnson, double doses. What are your thoughts on that? I certainly have some thoughts on it, but what are you thinking with Johnson & Johnson being added now to this whole armamentarium that we have of moving towards, herd immunity?
It offers a huge advantage because it's a single dose vaccine. It doesn't need that deep refrigeration. And while it was only 82% efficacious, it was 80 something percent and 100% to preventing death. And it was very good at preventing severe disease. So again, if it causes mild disease, we can deal with mild COVID. We can't deal with severe COVID and death. So, it may be that that's the right vaccine for people that are low risk, right? If you have low risk of severe disease, low risk of complications, it's a good vaccine to get. If you're going to have people that are going to see once and may not come back for a second dose, that's a good group to use. So I think there's a place for that vaccine. I think there's a place for every vaccine. Not all vaccines are the same, but at the end of the day, I think about a lot about the polio vaccine. We had the inactivated polio vaccine, we have the oral polio vaccine, we had different types of vaccines. We use them all, and we've almost been able to eradicate polio globally, and we eradicated polio from the Americas. So again, it's not that we need all the vaccines. We need vaccines, but most importantly, we need vaccines into the arms and into people, because a vaccine that is not used is not an effective vaccine.
Mm-hmm. I mean, I think that's such a great commentary on it. It leads towards, what are we thinking about with regard to mutations? We have the mutation in the UK, one in Brazil, one in South Africa. We see that Moderna and Pfizer demonstrated neutralizing antibodies in vitro, meaning in the lab, against these variants, and are moving towards maybe developing some clinical trials. There's also discussion on whether or not a third dose of the vaccine might be necessary, or some combination of the vaccine against the new variant and the old variant, or one just with the new variant. So many different conversations going on. And part of this is wrapped around, another common question that I receive is, am I going to have to get this shot every year? Will I have to get a third shot? So we talk about immunity, and we talk about mutations and variants and strains. How do you address those kinds of questions?
I tell people we have to say we need to be humble, and we say in this pandemic there's a lot of questions we don't know.
Mm-hmm.
And I can speculate. You may need a shot every year, like the flu. You may not.
Mm-hmm.
At this point in time, I just tell people, get the shot right now. We'll figure out that later.
Mm-hmm.
I cannot say that you're not going to, but I cannot say that you're going to. I mean, one thing that this pandemic has shown us is to be humble and not to predict where things are going to go, because the reality is, a year ago, I would have not predicted we're going to be where we are right now.
Right.
We would have, if a year ago we had this conversation and you would have said, 500,000 Americans are going to be dead and we're going to have vaccines, I'm going to say, what did you smoke, right?
Mm-hmm.
But the reality is that's where we are. So I think just stay informed, be humble. And again, right now, I tell people we're in a good place. Mm-hmm. We have vaccines, we have made progress, hospitalizations, cases are coming down. Let's seize the day. This is like the opportunity where, this is like when we're, top of the seventh and we're winning the game and you're bringing in your closer. This is when you can actually win the game, but let's just do the right thing and win the game.
Yeah, I think that's great. I love that baseball analogy. Yeah, absolutely. And I think we are getting closer, and we are certainly, inching closer, and we have more and more people, not a large amount, but we've had more and more people who've received both doses of the vaccine. And I think, at this point, as we begin to address the vaccine hesitancy more aggressively, I think you're absolutely correct in that a lot of these people are not absolutely no forever. They are a wait and see, and they would like to receive more information, and we need to be available to provide that information. And I
couldn't
think
agree with you more.
Important.
Well, listen, I'm going to have to leave you right now, but I appreciate the opportunity to be with you. And again, thank you for the work that Medical Association of Atlanta is doing. And I want to encourage everybody, if you haven't got your vaccine, get your vaccine and become a vaccine champion, because each one of us has a role to play to educate our patients, to educate our community, and to really help end this pandemic.
Right. Thank you so much. We appreciate you coming tonight. Thank you so very much.
Thank you, Dr. Del Rio. Dr. Morgan, I've got a question for you.
Yes.
If somebody asks me, how safe is the vaccine?
Mm-hmm.
Could anybody die from getting the vaccine? What do I tell them?
So, the safety profile of the Moderna and the Pfizer vaccines, and I have not seen the Johnson & Johnson data yet, is very, very similar to the flu vaccine. I think Dr. Del Rio just made a great point. When we are developing vaccines or even drugs, there are three phases: phase 1, phase 2, phase 3. The very first phase of any compound, before it's even a drug or a vaccine, we call it a compound, is phase 1, and phase 1 is safety data. So no matter how efficacious, meaning how well your compound or your vaccine works, If phase 1 data, the safety data, doesn't demonstrate that this vaccine or drug or compound is safe, then it doesn't move forward, regardless of how well that it works. When I looked at the FDA briefing documents of both Moderna and Pfizer, the safety profile was very, very similar to that of the flu. And one of the things that I always like to make the point is that when I drill down to look at subpopulations, specifically the African American population, that in Moderna was represented at 10.3%, and in the Pfizer trials was represented at 9.3%, which even though we represent 13.4% of the population, it wasn't perfect, but it was very good because in general, we represent less than 5% in any clinical trials. The African American population was the only population 2 weeks after the second dose to have no incidences of COVID-19. And so even though that vaccine had a 95% efficacy, in the African American population, it had 100% efficacy. And that's one of the messages that we try to work to get out to make certain that people understand that there was representation, that these vaccines are relevant to all populations. The safety profile has been completed, and we should have confidence that we can move forward safely with these vaccines to protect ourselves and to protect our families.
Is there any information out there if someone gets the first dose but has trouble finding a second dose? Is there any information out there on how long that first dose is effective before they would absolutely have to have the second dose?
Yes. So a couple of things. I'm trying to figure out where I want to start with this. You know, this is a changing and ever-changing landscape. I feel as if I need to time and date stamp everything that I say because next week it might be different. So I'm going to start with the beginning, and I will start with the documents that were actually submitted to the FDA and that data to review. And that data showed us that the first dose of both Moderna and Pfizer did not start providing immunity until around between days 8 and 12, and then really rose up towards that second dose to about 50 or to 60% protection. It was that second dose that took you all the way to that 95% protection, and that's why oftentimes people feel those side effects. Now, that being said, the Israeli studies that have just come out demonstrated that Pfizer, after a single dose in their country, brought them up to 89 to 92% efficacy after just one dose. This was not a randomized clinical trial. However, it was an observational study. So it'll be interesting to see how the scientific community ends up reconciling that. So that, you know, that's the history, I guess, on where we are with the two doses and do you have protection from those doses. So those are the things that we want to consider very clearly. So what you really are referring to in the second part of your question is something that we call exceptional circumstances. The CDC has come out with something called exceptional circumstances, and there are two of them. One of them is if you receive the first dose of Moderna and cannot find a second dose of Moderna, you can move forward with the second dose of Pfizer, if that's what you can find, and vice versa. You can start with Pfizer and end with Moderna. It's called mixing of doses. And if you have an exceptional circumstance, so for instance, this week, Texas had the deep freeze. I'm certain there were people who needed their second shots who weren't able to access them. So that would be an example of an exceptional circumstance where you need to move forward with what you have. The second exceptional circumstance, which is what you're moving towards, Randy, is what is the time frame from that first shot? So Moderna's doses are 4 weeks apart. Pfizer's doses are 3 weeks apart. The CDC has said you can move out to 6 weeks and still receive that second dose. The CDC wants to encourage people to have their doses, and if you meet exceptional circumstances, and that's really up to you and your physician, there's no list of what those exceptional circumstances are. Maybe you were hospitalized, maybe you're in a car accident or anything. Maybe you weren't able to access it. We can still provide that second dose up to 42 days. The fact of the matter is, even if you still have exceptional circumstances, we still want you to get the second dose, even if it's beyond 42 days. So that's the answer to that question.
Yeah.
A moving landscape. So, yeah.
And that's one thing that's important to remind people. This is going to be recorded and can be accessed later on. And this is information that's current as of February 24th, 2021. So if you're watching this at a later date, some of this information may change. If I'm someone who is on a immunosuppressive medicine or a biologic, say for a rheumatoid condition or lupus or something like that, is there any special timing I have to have with coordinating my vaccine with other infusion therapies I may be getting that affect my immune system?
Mm-hmm. So these are good questions that go into sort of these chronic medical conditions that we manage, these so-called comorbidities. And again, when we look at the Moderna and Pfizer trials, over 70,000 people were enrolled in those two trials collectively. That included patients with chronic lung disease, almost 1,500 people with significant cardiac disease, almost 1,500 people with liver disease, almost 200. It also included diabetics, almost 3,000, hypertensives, almost 9,000, people with any form of cancer whatsoever, I believe around 1,400. And it also included 176 HIV patients. And so it's these patients where we get some of our immune data from. And so the point that I'm making is that these trials were done for safety and efficacy, specifically against the SARS-CoV-2 virus that causes COVID-19. These trials did not specifically look at any of these chronic medical conditions or any of these comorbidities. On the other hand, they did not exclude any of them either. So many medical conditions, including all forms of cancer, were included in these trials. And so when we look at this safety data, when we look at the efficacy data that the FDA reviewed, all of these people were included, including obese patients, 10,000. So these are the things that we have to think about. The only infusions where you need to at least wait 90 days before you receive either of the COVID vaccines that are currently available, Pfizer or Moderna, would be if you've had COVID-19 and you've been treated with either convalescent plasma, an infusion, or a monoclonal antibody therapy. If you've had either of those infusions, meaning an IV went into your arm and they treated you with IV medication, convalescent plasma, or monoclonal antibody therapy, you need to wait 90 days before you start your vaccine series. Yeah. One of the other things that questions that I often get is, the long haul syndrome. And I want to spend a little bit of time talking about that because long haul syndrome is something that many people really don't think about or they may not know. And what it is patients who've had COVID-19 can still have symptoms many months out, even up to 9 months. And those symptoms generally are oftentimes neurologic symptoms like long-term loss of taste or smell, or chronic headaches, or brain fog where you are disoriented or you're having difficulty with your memory. And they can also have cardiac and lung manifestations with chronic inflammation and be on medications for a long period of time. About 30% of people who are COVID positive and have recovered from COVID, about 30% will develop long haul syndrome. And this cuts across gender, it cuts across race, it cuts across socioeconomic, it cuts across time of hospitalization. But interestingly, it also is independent of whether you had a severe COVID infection and were hospitalized, or if you had a fairly mild or even asymptomatic infection and just sat at home and waited out your 2 weeks and you felt fine, you may actually begin to feel worse months down the road. And that's this long haul syndrome. So that's something to think about as well when we want to consider the vaccines to protect us from COVID-19, we have to also consider for people who say, well, you know, I'm young, this is just going to be a mild infection in me, I'm not going to feel it, everything will be fine. 30%, it appears to be 30%, may develop some of these long haul symptoms down the road. So these are some of the things that we need to think about. And as we, you know, develop more and more and more information and learn more and more about it, we'll begin to, you know, continue to provide more information regarding that. So another reason to really consider these COVID vaccines, and it's unclear who will develop long haul syndrome and who will not. We cannot identify these patients yet.
And don't really know right now how long it'll last or
That's right.
or what to do for it.
That's right. We're seeing it up to 9 months. And, you know, some people are on, you know, chronic therapies, steroids, they have chronic fatigue. People, especially who've been very active, have been unable to return to their normal lives. And so these are the kinds of things that really can be devastating to your quality of life. You really weren't sick. You were at home, you played video games, you sort of watched your clock and waited 14 days and you were out. And then later you may develop them. The same as someone who was very sick, had a long hospital course, was intubated in the ICU. You have the same risk, as far as we can tell, of developing long haul syndrome. So that's something that's still very poorly understood, but something to think about when you consider these vaccines.
So younger people, when their time is to be vaccinated, should consider getting the vaccine because of that type of risk as well.
You know, that's one of them, certainly. That's one of the risks, but also, you know, your elderly grandparents that you'll be visiting, all of these things you want to, the vaccine not only protects you, but it protects those around you. Because even if you get an infection, it will be milder, your viral load is less, you're less likely to infect people if they are around you. If they do get infected, their course is likely to be milder because they had a lower inoculation, meaning that viral load that came from you because yours was so much lower. So these are all things, you know, to consider, not only about yourself, but the environment and the people around you, such that we can work to begin to return our lives to some semblance of normalcy.
You know, right now, obviously, there's not enough vaccine to go around. And so people have to make tough decisions about who
Right.
gets it and who doesn't get it. Is there, to your knowledge, and I know this is, you know, somebody has to make these hard decisions, is there any research information out there that would tell you one way or another who the best people are to be getting the vaccine at a certain time? Or is this something that is just a medical best guess right now?
Yeah, and I'll tell you what the conversation is in the scientific community. So when we look at this new vaccine, J&J coming out, we think it'll have emergency use authorization within the next week. And again, I want to say today is February 24th, 2021. And that being said, because the efficacy is somewhat lower than Moderna and Pfizer, with regard to what their endpoints are, the thought is maybe that vaccine should be given to our healthier population that runs a decreased risk, so some of our younger people. And then, as Dr. Del Rio also commented, on some of the people who are transient. And when I say transient, I don't necessarily just mean homeless. I mean people who move around a lot. You may only have one shot, one opportunity to get them the vaccine. So you don't want to start a 2-dose vaccine regimen and you know they are not coming back for that second dose, especially when we talk about, you were concerned about mutations and strains developing. And so I think, as Dr. Del Rio also pointed out, that there's going to be a place for all of these vaccines. Actually, there are 135 companies currently developing COVID vaccines. And so we have to really think about that, because Moderna and Pfizer have been first to market, but when all is said and done, they may not end up being best in class. There's always an advantage to being first without any competition. Now, obviously, they've set the bar very high. What I suspect will happen is that after all of these companies have shown their hands, we probably will have multiple vaccinations on multiple platforms for different indications. Some may be indicated to have a greater degree of effectiveness in children, maybe some in the elderly, maybe some are better in heart disease, maybe some are better where refrigeration isn't required, maybe some are better where you only have an opportunity to give one shot. So I suspect there's going to be room for a lot of different types of COVID vaccinations to come on. Something we should think about is almost none of them, as far as I know, certainly not the first 6 that are coming out, are using the old technology of attenuated live viruses, meaning the real virus that's been weakened to a point that doesn't make you sick, but it induces your immune response such as you recognize it next time and protect you. So even though these 2 are messenger RNA, Pfizer, Moderna, the next 2 that are on the docket to come out, if we look at sort of J&J, these will be viral vector vaccines, where we have an adenovirus that's going to transport the spike protein in. And then we have, Novavax is also, making headlines. That will be even a different platform where the spike protein will be there directly, or protein inoculation. So I think, and I'm not developing these vaccines, that the days of live attenuated viruses, may be foregone. And as we move to these different platforms, one thing that's also advantageous is that we can quickly modify them and quickly change them. And I think we're seeing Moderna and Pfizer do that, as well as they develop different formulations against these new strains that are coming out. And so that's one of the advantages as well. We can manufacture and develop them quickly.
Right now, the vaccine is only approved for people, I think, 16 years and older.
Mm-hmm.
Is there any thought about ultimately vaccinating children?
Oh, no, absolutely. So Pfizer's vaccine is approved for 16 and older. Moderna is approved for 18 years and older. So let's talk about Pfizer first. Pfizer just completed a trial of 3,000 children, ages 12 to 16. So these are called bridging down studies, where all of the data has already been done and completed in adults, because these compounds, these vaccines, are not specific to children. So we can actually use the adult data and extrapolate it, and then do bridging down studies where we enroll them. And Pfizer just closed out their trial. Moderna also has a trial ongoing, ages 12 to 18. Generally what you see in pharma and vaccine companies is that children are done in 3-year increments. So it's 15 to 18, then 12 to 15, then 9 to 12, then 6 to 9. And the reason that that's done, if you can, you probably understand this, is that the younger the child, the more difficult it is to recruit them, for their parents to allow their children to be recruited into trials. So the older children are able to be recruited first, and then it's more difficult for the younger child. And then if you add in the fact that it's a needle, then you can imagine, most people will not subject their children. Now, one reason that we do see children enrolled in trials is if the child is ill, and this is a specific compound that will address that chronic medical condition. They would be, motivated to be in the trial. The other reason in these trials is if you want your child to be protected, you may move forward and enrolling them in the trial such that they can be vaccinated, they can go to school, you can have some peace of mind. And so that's where we are with those Pfizer's at 12 to 16. So their next group should be 9 to 12, but they may reach down and do 6 to 12. So yes, data on children is coming. I suspect, I don't know, unless we see something very different happen in children, it maybe won't come out under emergency use authorization, because that population by and large has still been pretty healthy. There may not be a reason for an EUA, but I'm not on the FDA panel, so I'm not sure. But I don't anticipate that there would be something within the next 6 months that's not FDA approved.
Lots of people on getting the vaccine are experiencing, mild but uncomfortable side effects, headaches, fever, joint pains, things like that. Are there recommendations regarding any medications you can or can't take, or when you can take them for those symptoms?
Mm-hmm. And I think that's a great question. You can take really all common analgesics. We recommend them after the shot and not prophylactically before the shot. And certainly the common side effects: nausea, vomiting, chills, fever, headache, myalgias, which are muscle aches, and then injection site pain and swelling. One of the things that we like to recommend is that you try to get the injection in your dominant arm. And your dominant arm is that side of your body that you use the most. So if you're right-handed, it would be your right arm. If you're left-handed, it would be your left arm. The reason for that is that you would use that arm more, and you can spread the vaccination away from the injection site and decrease the amount of stiffness that you have. When we receive inoculations or vaccinations in our non-dominant arm, when it starts to hurt, we tend to cradle it and protect it because we can still move on with our other dominant side. The only other thing that I would say, if for some reason you have swelling in that arm that starts to concern you, I want you to take a magic marker, outline that area of the swelling and watch it. If it increases or it doesn't decrease, then that's a reason to contact your doctor and make certain that they take a look at it. Yeah.
One last question, and then I'll let you address anything you'd like, but and it's a big one. Pregnant women, who should get the vaccine and who shouldn't if you're pregnant?
Yeah, so the American College of Obstetrics and Gynecology, ACOG, and the CDC are both, and the World Health Organization, all three, are recommending that pregnant women move forward with these vaccines. The reason for that, one of the reasons is that if a woman who is pregnant contracts COVID-19, her risk is much greater of having a poor outcome and complications than if she takes the vaccine and doesn't have these complications from COVID-19. Something to think about in both the Moderna and the Pfizer trials. Pregnant women were excluded from these trials, which is not uncommon. Generally, we do not enroll pregnant people into trials that are not specifically looking at something related to pregnancy. But what happens? Life happens. So in the Moderna trial, 13 women ended up pregnant. And in the Pfizer trial, 23 women ended up pregnant. So we ended up with a little cohort of 36 patients to follow and study throughout their pregnancy who received the vaccine and subsequently became pregnant. And so far, we've seen nothing in those 36 women. Obviously, a very small cohort within a group of 70,000 people, so that's a tiny cohort. And these are unintended pregnancies. When I say unintended, the companies didn't intend for them, not the people. So these are unintended pregnancies by Moderna and Pfizer. But it gives us information, right? And we can follow these people. So far, we've seen no deleterious effects coming out of those pregnancies. And so the CDC, the American College of Obstetrics and Gynecology, and the World Health Organization are all in agreement that pregnant women can move forward with these vaccines.
Great. Well, thank you very much. Any parting thoughts before I wrap up?
I would say if you have an opportunity to get this vaccine, step up and consider it. Another common question that I receive is regarding allergies. And remember, this is not a live virus. This is messenger RNA. This is not a biologic. So allergies to chicken and eggs and your environmental allergies and snake bites and venom and bee stings, none of that applies here. The allergies that are of concern, mild concern, is if you've had a severe allergy to a previous virus. You still can move forward with this virus, but you must wait with this vaccine, but you must wait 30 minutes and make certain that you are observed for 30 minutes before you leave the vaccination site. And the other thing to think about is if you have an allergy to polyethylene glycol. And why do I bring that up? Polyethylene glycol is a type of lipid or a type of fat that is a part of the emulsion of these messenger RNA vaccines. If you have an allergy to that, then you're also contraindicated from taking this vaccine. You would know that you have an allergy because polyethylene glycol is commonly found in laxatives like Miralax, Go Lightly, etc. And so you would know if you've had an allergy. So thank you, Randy. I appreciate coming on tonight. I appreciate having an opportunity. I learned a lot. I learned so much from Dr. Del Rio. And I appreciate the opportunity to be here and to represent the Medical Association of Atlanta.
Thank you, Jayne. And I want to thank all the participants too on our town hall meeting tonight and those who submitted questions. We hope we have some good answers for you. I'd like to ask everybody on this call, with your help, with one thing. And you may notice that I'm wearing an orange button, which has the I have got my COVID vaccine message on it. And the Medical Association of Atlanta is produced these buttons. We have these available for you. And as you heard Dr. Del Rio say, one of the most important things that we all can do is to spread the word about vaccination, to live by example, to show others, whether we're physicians, whether we're just showing other people in our family or our church or our community. This is going to be a key factor in winning the battle against COVID. So if you would like to receive a COVID vaccine button, or if you have a medical practice and would like to receive buttons for your entire staff, please contact the Medical Association of Atlanta. We'll leave the email addresses on the screen for a little while after the webinar so that you can see it. And just give your mailing address and request the number of buttons you would like. We will be happy to mail them to you as our supply permits. So thank you again. Thanks for everybody on this call, and good night, and stay safe and stay well.
Good night.